When you walk in, you will fill out your paperwork, both sides, and one of us will present you with two regulators and say, pick one, turn them around so I can't see where your thumbs are. Just turn them around so the
Got it.
okay, and I'm gonna pull this one. And a smart person will look and say, there's no O-ring, may I have the O-ring? And put it in, and you just check off a skill. And then you will be prompted, you can start when you're ready. So I would make sure that I have on gloves and an appropriate oxygen delivery device. You will be asked, tell me 3 ways you know this has oxygen. It's green, it has the yellow sticker that says oxygen, and on this side of the valve, it's stamped oxygen. Of course, your 4th option is it has the 2.5 pin index. So I want to dent the cylinder for 1 second to blow out any dust or body oils. Reconfirm the O-ring. Attach, turn it over this way. Attach the regulator. And finger tighten it in place. Turn it gauge down. Hold on to the tank. Open the valve all the way. Until it stops, and then back a quarter of a turn. Roll the tank so the gauge is up. I put my phone there to block the tank from rolling. I have right at 1,000 pounds, and you may be asked that, and you would be asked what's the safe residual, which is 200. So do I have a conscious or unconscious patient? Pick one. Then I have implied consent. Odds are you'll be told that it's a conscious patient. So ma'am, I see you're having difficulty breathing. I have some oxygen here and I think it may help you. May I give you some? And she nods her head or says yes. So I'm going to attach the tubing. I'm going to set my flow rate at 10. I'm going to pre-fill the reservoir bag. And I will place the mask on his or her face, put the straps in place, adjust the straps, adjust the nose piece if I need to, and monitor my patient. I'll monitor my patient in my office till I decide that it's appropriate to take the mask off, or EMS or somebody comes and takes over and says I can discontinue the oxygen, in which case I always remember to take the mask off of the patient before I discontinue the flow. I can take the tubing off at any time. I'm going to close the valve. I went the wrong way. I went a quarter turn. I'm going to turn to the right, clockwise. And I'm going to lead the pressure out of the regulator. Take that back to 0. Take the valve off, and you will be asked to give 2 reasons to give oxygen to a patient. Today, I think I will go chest pain with signs of poor perfusion, low pulse ox reading, high blood pressure, high pulse rate, and oxygen may help relieve some of those symptomatology and decompression sickness since I'm a diver. So I have too much nitrogen in my tissues, so oxygen will help relieve the symptomatology as well. And